Hello and a warm welcome to RX Medical Consult. Today we've got an important topic on our hands. We're going to take a deep dive into the world of birth control methods, covering all the details you need to know. We'll explore the various methods available to prevent pregnancy, from the commonly known like pills and condoms to the lesser known options. I'll explain where and how each method is used. Some you take orally, while others involve injections or devices placed inside your body. We'll also discuss the reasons why pregnancy can still occur even when using birth control, as understanding these factors is crucial to making informed choices. And of course, we won't shy away from talking about potential side effects because it's essential to know what you might experience when using these methods. So, settle in and stay tuned for a comprehensive exploration of birth control methods. We're here to provide you with the information you need to make the best choices for your reproductive health. If you're watching this video, I'm guessing you know what contraceptive means, but if not, no worries, I'll explain. Contraceptives are just things that help you avoid getting pregnant when you don't want to. In Ghana, most people know about pills and condoms, but there are lots of different types out there. We'll talk about some of them in this video. Contraceptives are split into three groups, most effective methods that can be reversed easily. Examples include IUDs, intrauterine devices, implants, female sterilization, and male sterilization, highly effective methods. Examples are injectables, pills, transdermal patch, vaginal ring, and diaphragm. Methods that are less effective but still reversible. Examples include condoms, lactational amenorrheic method, withdrawal, sponge, periodic abstinence, and the spermicide. Let's begin with the first group, the most effective methods that can be easily reversed. These are excellent at preventing pregnancy. Now, I'll be explaining each of the contraceptives in detail under the most effective methods, starting with IUDs, intrauterine devices. The Paragard Copper T380A intrauterine device, or copper IUD, is a small and flexible contraceptive device placed inside your uterus to prevent pregnancy. It's a reversible method and is incredibly effective, with a success rate of over 99%. Plus, once inserted, it can stay in place for up to a decade. So, how does it work? Well, it hinders the sperm's ability to reach and fertilize the egg. There's a slight chance, around 5%, that it might come out during the first year. To ensure it's still in place, it's advisable to check for its small strings after your monthly period. Now, let's discuss who should avoid using the copper IUD if you currently have a pelvic infection, such as pelvic inflammatory disease, PID, or if you have irregularities in your uterine cavity, experience painful periods, heavy menstrual bleeding, have fibroids, or suffer from bleeding disorders. This method may not be the best fit for you, but what if you develop PID while using the IUD? Well, you can receive treatment without needing to remove the device. The copper IUD is suitable for women who have never been pregnant, teenagers, those with a history of ectopic pregnancy, HIV-positive women, and those who have had PID in the past. Now, let's talk about potential side effects. Some individuals may experience longer or heavier periods, especially during the initial months. Others might encounter discomfort during sexual intercourse or even back pain. However, it's important to note that this IUD can also serve as an emergency contraceptive, and it can be inserted immediately after childbirth to prevent another pregnancy. One notable advantage of this method is that it won't impact your weight since it doesn't affect your hormones. In essence, it offers a hormone-free option that allows you to control your family planning without hormonal interference. Now, let's take a look at another type of IUD, the levonorgestrel intrauterine system, also known as Mirena. Unlike the copper IUD, which relies solely on copper, this one is a hormonal IUD. It's super effective with more than a 99% success rate, and it can stay inside for up to 5 years, unlike the copper IUD, which can last up to 10 years. So how does Mirena work? Well, it thickens the cervical mucus, which makes it tough for sperm to move around, kind of like a fly stuck in honey. It also thins the lining of the womb, making it not so great for implantation or pregnancy. Normally when sperm meets an egg, the womb's lining gets thicker to support a growing baby, but with Mirena, even if the sperm manages to meet the egg, it's not a welcoming place for a pregnancy. Mirena releases 20 micrograms of levonorgestrel into the uterus lining every day for 5 years. After that, it keeps giving you a smaller dose, 14 micrograms, for another 2 years. In some women, it might even stop ovulation. Side effects of Mirena. When using Mirena, many women notice their periods get lighter and shorter in the first 6 months. By the end of the first year, spotting usually stops and periods might only last 1-2 days a month. So if your period usually hangs around for a whole week, with Mirena it might be just a few days, even as short as 3 days. But if you're watching this video while on Mirena and something seems off, don't worry too much. It's often normal. But if you're not using this method and you're experiencing unusual symptoms, it's a good idea to visit your clinic for a checkup. Some women also report weight gain with Mirena, mainly because of the hormones it contains, and there can be breast tenderness too. Now, the advantages of using Mirena: it's a top choice for women with heavy periods and menopausal women using estrogen therapy. It can help with menstrual pain. Plus, many women using Mirena have lighter periods. And when you decide it's time to remove it, your fertility returns right away. Before we move on to the next highly effective birth control method, jot down any questions you have in the comment section so you don't forget. We'll do our best to answer them. Now, let's talk about the next one on our list: implants. Implanon. Implanon is a reversible and effective birth control method. It's a small, flexible rod, like a matchstick, placed under the skin of your upper arm by a trained clinician. It gradually releases a hormone called etonogestrel, which prevents pregnancy for up to 3 years. When used correctly, it's super effective, with only a tiny chance of failure, 0.1%. The main downside is that it can cause irregular and unpredictable bleeding, and it may leave a small scar where it was inserted. But on the plus side, it can reduce menstrual pain and doesn't affect your fertility once it's removed. Norplant. Norplant is another contraceptive implant, but it has 6 rods and lasts for 7 years. It's quite effective, but it's not widely available. Jadel. Jadel is similar to Norplant, but it only has 2 rods and lasts for 5 years. Again, it's not as common as Implanon. Implanon is the most popular and accessible among these options. In our next video, we'll talk about permanent birth control methods, both for men and women. We'll explain how the procedures work and what to expect afterward. Don't forget to subscribe so you won't miss it. Stay safe.